I worked at Goodfish Lake Health Centre for many years, and I was considered the nurse in charge. When I first went there, I was young and didn't know anything. Had never done public health before, didn't know anybody there. Some of the main things were some people's resistance to immunization. A lot of people went off the reserve for an education, went into the city and whatever. And so you didn't know if they were following their immunization. Then we brought in this program. CHIP was an electronic health record of immunization for the community and for some of the surrounding communities. For instance, if they moved to another reserve, they would be able to follow that child and make sure they had had their immunization or had not repeated it somewhere else. It was supposed to take over from the child health written record. Then the nurses, for instance, would be able to look back into the CHIP records and find what immunization that child or adult had had at any number of reserves. Once we got used to it and got on the ball with it, then it worked out well. We had a very good immunization record at Goodfish Lake. The fact that our immunization rates were as high as they were and had been that way for many years is also something that I was quite proud of. It was interesting to see some of the children that I had seen as babies and now were parents. You know, you see somebody that was middle-aged before and now they're an elder, and I'm thinking, oh, and then you realize, oh, maybe I am too.